Hemochromatosis. Hemochromatosis has been an interesting disease to study, as my dad has this condition. I had the opportunity to talk to him about his experience living with it, and to conduct my own research to learn more about the inner workings of this phenomenon. Hemochromatosis is a disorder in which extra iron builds up to the body to the harmful levels. This buildup can affect the skin by changing to a more bronze color. It can also affect the heart, the pancreas, and more notably, the liver. When left untreated, it can potentially lead to diabetes, heart problems, liver damage, and even liver cancer. In the liver, iron levels are controlled by the hepcidin regulatory pathway. It can be said that anything that disrupts this pathway can lead to hemochromatosis. Hepcidin is a negative regulator for iron absorption. There are four main types of hemochromatosis, each affecting the hepcidin regulatory pathway. Type 1 is associated with a mutation in the HFE1 gene, which makes it autosomal recessive. Although there are multiple mutations responsible for hemochromatosis, we will focus on type 1 in this presentation. Mutations in the homeostatic iron regulator, or HFE gene, in chromosome 6 is what leads to type 1 hemochromatosis. At low plasma iron concentrations, the HFE protein is bound to the TFR1 protein, therefore signaling the hepcidin to remain silent, which, as mentioned before, is a negative regulator for iron absorption. So when it is mutated, HFE protein is permanently bound to TFR1 protein, regardless of the iron concentration. This binding leads to diminished production of hepcidin, thereby leading to an increased iron absorption. One of the most common mutations in the HFE gene is an amino acid change at position 282, changing it from a cysteine to a tyrosine, or the C282Y mutation. The mutation causes the loss of a disulfide bond, which interferes with the interaction of the HFE protein with beta-2 microglobulin, affecting its original purpose. The C282Y mutation dates back about 6,000 years ago among ancestors of the Celtic population. As a result, people with Northern European descent are more likely to develop the disease. It is estimated between 1 in 200 to 1 in 400 persons of Northern European ancestry is a C282Y homozygote. Something interesting about hemochromatosis is that men are 2 to 10 times more likely to develop hemochromatosis than women. Because women menstruate, they naturally lower their iron levels every month. Typically, the only time when women start displaying symptoms of hemochromatosis is after menopause. Diagnosis. Common symptoms of hemochromatosis are presented below. Hemochromatosis can be diagnosed by blood tests, where they test for levels of iron, levels of transferrin, and levels of ferritin. Another way to test for hemochromatosis is through genetic testing, where they test for the common disease that are responsible for the disease, like we discussed in previous slides. Finally, a liver biopsy can be done where they take a sample of liver tissue and stain it for iron, which will show whether too much iron appears to be present. Something to mention regarding hemochromatosis is that many people don't realize they have the disease. Also, even if they do have the mutations, it doesn't necessarily mean they will develop hemochromatosis. My dad, for example, never got genetic testing and was simply diagnosed because of the iron levels in his blood test. Treatment. There are 4 ways hemochromatosis can be treated: phlebotomy, changes in diet, and medicine. Phlebotomy is the most common treatment, which essentially means blood donation. By regularly donating blood, iron levels can be brought back down to normal. Blood donated by patients with hemochromatosis can be used by others. One drawback to this treatment is that it must be carried throughout the patient's lifetime in order to maintain stable iron levels. The second treatment of hemochromatosis is the diet. A person diagnosed with hemochromatosis must avoid food with high levels of iron, like red meat, beans, eggs, etc. There have also been studies to see which food can actually precipitate iron out of the body. Polyphenol-rich dietary sources like black tea powder, cocoa powder, and grape juice extract can effectively precipitate iron in vitro, which decreases dietary iron absorption. The third treatment of hemochromatosis is chelation therapy. Chelation therapy is similar in technique to polyphenol-rich food, as it uses special drugs that bind to metals in your blood, but with more efficiency. You can get the chelating medicine through an IV in your arm. It is also available in pill form. Chelation is sometimes used in people who have iron overload but cannot undergo phlebotomy because they also have anemia. Overall, there is much to be done regarding hemochromatosis in the future, especially as our knowledge of human genetics grows. Looking to this disease has allowed me to understand my dad's condition, and even to suggest new options of treating hemochromatosis to him. Thank you so much for listening.